Well, there are many different forms, of course, of heart disease, a condition often associated with a host of symptoms, things like chest pain, numbness, weakness in the arms, shortness of breath. But sometimes this leading cause of death comes with really no outward signs at all. In today's HealthCast, we take a closer look at asymptomatic heart disease. When it comes to taking care of himself, 61-year-old Richie Lucas was doing everything right, exercising regularly, eating primarily a plant-based diet, and taking time to relax.
Avid fitness person, always looking out for the numbers and doing anything I can to, stay ahead of the fitness curve.
Regular physical exams, even a cardiac stress test, all suggested his heart was healthy until a coronary calcium test revealed all arteries to his heart were nearly 100% blocked. Richie suddenly found himself undergoing a quadruple bypass.
I wasn't nervous going in, I was more stunned, so that this is where this is at.
Memorial Healthcare cardiac surgeon Dr. Michael Cortelli says nearly half of all heart attacks may have no early symptoms at all.
That doesn't mean that patients don't have risk factors still. They could be asymptomatic and have risk factors, but then there are a subset of people out there that are asymptomatic and have no perceivable risk factors, or at least that they know of. So those are the ones that we worry about.
Dr. Cortelli says no one diagnostic test can perfectly predict your risk, which is why routine physicals and knowing your family history are vital.
And that may alert them to the possibility of there being a problem.
Now, 1 month out of surgery, Richie is finding the way back to his normal routine.
What I've actually liked about this is that it's turned on some of my friends to go get checked. So, and they're like, you know what, I haven't had this done, so they're going out and getting checked, which that to me is, it's not worth the price of a quadruple bypass, but I'm glad I can at least pass it on.
All right, well, experts say asymptomatic heart disease is a lot more common among diabetic patients, and what many people overlook are some subtle symptoms. Do not overlook things like excessive sweating, sleep disturbances, and stomach issues. They can also be a sign of heart troubles.